Back in the
Yeah.
day, 1990s, let's say when lasers, people
Oh,
were getting CO2. This was like a
yeah.
2 week long
Yeah.
oozing,
Nightmare.
get put
Bad. Your
out.
face
Your
is
skin looks,
off.
you
Yeah.
don't even have pores anymore. Like it
Yeah.
looks
Your face
plastic.
is gone. You look like something from a horror show. This is MedSpa Mayhem, the podcast all about the chaotic world of medical aesthetics. From Botox to lasers to IV bars, learn how to tell real versus fake, legal versus illegal, and safe versus potentially deadly. Hear the crazy stories inside the med spa world and find out what questions to ask and how to spot the people cutting corners. I'm your host, Dr. Kate D. Together, we explore the wild west of medicine that is the aesthetics industry. Hi, this is Dr. Kate D, and I'm interviewing today Rachel Lowe Jap. She is a laser expert, and I've been wanting to have her on the show to talk all about lasers and what her favorite treatments are and what to look for and what are the risky things. So, Rachel, thanks so much for being on the show today.
Well, thank you so much for inviting me. It's a pleasure. I appreciate your time and looking forward to having a great conversation with you.
So, I really am excited to talk about this. Can you tell our listeners your story and how, because it's been really interesting. So, you're an esthetician and then actually and became a laser tech and a laser expert and then actually became a nurse, but then didn't do nursing. So, can you tell your story about how you got to where you are now?
Sure. I'm going to start and rewind back, right? When you were a kid, was there something that you wanted play wise, like a kit? Like I wanted a doctor's kit or a microscope. Like, can you remember back that
Oh,
far?
totally. I mean, you know that game Operation? That was
Yes.
me. I was
Oh
totally, I
man.
love that. And actually had no clue that that meant that maybe I was going to be a doctor, but that was to what like my thing.
That's like a great sign. So, right, it led you into the medical field in a way. I like that game too. I was so afraid to touch the edges though. So, but I remember being in a mix of liking, I had a microscope and I would look up plants and leaves and bugs, but then I also loved painting my Doberman's fingernails red and doing makeup, right? So it's kind of a weird mix, but it brings me to the point. I was probably in third grade. I had eczema or some rash, and my grandmother took me to this dermatologist, and I'll never forget. This was mid 80s. And her logo, when I pulled up to the building, was like a side view of this woman with this 1970s like Farrah Fawcett hair, and it was Dr. Janie Feinberg, dermatology. I went in there and she evaluated me and gave me this little tube of like a probably steroid cream, and I just felt like so special. And she gave me a shirt. So, at the age of wherever you are in third grade, I decided I want to be a dermatologist like Joni Feinberg, and that's kind of what I wanted to do based on that experience. And then moving forward, loving the cosmetics. When I was 15 in the state of Florida at the time, you can become a licensed nail technician. You can go to school. And so that was my gateway into the beauty industry. So I started seeing clients when I was 15, working in high school part time and just kind of going that way. And, one thing led to another. I got a job in a spa and got a facial in exchange for nails. And I was like, oh my gosh, that was nice. But I went to school. I actually joined the Marine Corps a year early. I graduated high
Oh
school and
wow.
joined the Marine Corps. That lasted a little over a year. Broke my leg jumping out of a helicopter.
Oh no. Oh my gosh.
Yeah,
Okay.
probably wouldn't have been a good job for me anyways. But it
Wow.
led me to come back and go into aesthetic school. And so by the time I was 21, I had an associate's degree in natural health, and I did an aesthetic license, a massage therapy license, a nail license. So I kind of went the spa route. Shortly after, about 2 years in, I decided I can't get rid of this brown spot for this lady. What do I do? And then I interviewed and accepted a job in a dermatology practice. And this was pre lasers, by the way. Botox was not even FDA approved yet.
Mm-hmm.
So
Yeah.
there's not much to do but chemical peels and microdermabrasions. And so I just kind of got into it. And then one day they brought a laser in, a laser scope laser. It was a long pulse YAG. I'll never forget. We were doing hair removal in veins, and
Mm-hmm.
they would drop them off for 3 days at a time and then rent them. And then you would turn them back in. And so every
Okay.
month I started becoming more and more fixated on it. And due to the laws, I was not able to to practice. And so shortly
Because that
after
was in
brought me
which that was in Florida still?
Florida. Yeah,
Yeah.
it was only, I believe, PA,
Mhm.
and that's it. And so I went on a pursuit to do lasers. I found out that in New York State, which I was already in love with the city, that you can do that under a medical director with proper training. And so I pursued that and I moved to New York, and I have been doing lasers from 2003 on.
Mhm.
And I will
Which
say
happens to
that
be the same year Botox was FDA approved
that's
for
right.
cosmetic use. Yeah,
That's very good that you know that.
well, 2003 to me is like the birth year of the aesthetics industry.
I love
So
that.
I
I
yeah.
I got goosebumps because that was my birth year of lasers and Botox, and I
Right.
didn't
So you
correlate
grew
them.
up with the rest of the industry. So, and I think one thing that you talked about, which our listeners may be a little bit familiar, is all the laws in every state are different, and they're all different for all the different aspects of the industry, right? So, laser in particular has its own set of laws that might be completely different from, say, Botox injections. So it's super complicated to kind of figure out what's legal where. Yeah.
I know that is a struggle. And it's even more super complicated if you want to do lasers, find a business or a person that can fundamentally teach you, not just in
Yeah.
a 3-day course, right? Not just talk at you. And
Mhm.
so I think it took me about a good 5 years at least before I could gather enough information to truly be able to like speak it and how it works from start to finish.
Mhm.
And that's a
So
struggle.
that gets you to New York. So now you're in New York, and then what happens?
So I'm in New York and I'm lasering at Laser Cosmetica. It's hair removal only. It's like a workshop. I'm in there doing 12-hour day shifts. The days
Mhm.
I can't get a full shift, I'm teaching paramedical aesthetics, which is aesthetics going into working with a plastic surgeon or a dermatologist, which that niche didn't really exist. And so
Mhm.
Atelier Esthétique was a big school in New York City. Annette Hansen owned it. And I helped her write this course on paramedical aesthetics. The state approved it. And I started teaching that in 2004, 5, and 6 while I was lasering. We bring
Okay.
in the laser program, and New York starts thinking about offering that through the board of cosmetology, and that was ended up being a 1 week long course for 40 hours covering hair removal, brown spots, non-invasive things, which enforce, but they don't. So it's a tricky situation that they offer it at schools, but they don't enforce you to have it. Meanwhile, you cross the bridge and go to New Jersey, and you can't even touch a laser unless you're a PA or MD.
Yeah.
It's just
Yeah.
such different.
Very, very different laws. So that course, that 1 week course, 40 hours, so after someone did that course, do you think that they would be able to start doing laser supervised by somebody? Or do you feel like, because one of the things that's hard, right, is there is no official, laser training. And this is true of the rest of aesthetics, right? Even for doctors, there's no residency. For everything else, there's at least 3 years of residency training for everything we do. And aesthetics, there's really nothing. There's a course here or there, and the course might be a few days. So
I would
at least we
say
understand
no.
medicine.
Yeah, yeah.
Right.
So, and that's the thing, right? You can, let's say you go to school for aesthetics, the focus is on skin, the health of the skin, the anatomy, the structure of the skin. So, I think it's very important to have that knowledge at a basic level before you just start getting certified on a laser. So, in this 1 week laser school, I believe you have to be a licensed esthetician or something on the realm of having a background. But if you, let's just say, you're an MD and you want to go to Empire Medical, they offer a 2-day course on laser physics and you can earn your CMEs. Honestly, somebody take it from me, we're talking at an audience full of 100 people. And unfortunately, you get a few hours demo, but until you get hands-on application and,
Yeah.
and learn the skin's response and tissue interaction, I don't feel like you're ready to go out there and do it.
Yeah. I mean, I think that it's really problematic, right? So, would you guess even that if you take all the people out there wielding lasers across America, right? What percentage of them actually has the knowledge and experience to safely do that?
Wow.
I mean, is it half even, do you think? I don't
I
think it
would
is,
say
but
no. I'll tell you what the difference is there's people like you that probably wouldn't fire a laser unless you really knew everything about that laser and the skin or try to
yeah.
understand it your best way. Let's say you owned a med spa, which you do, but let's say you were just delegating and the laser rep told you this is safe to do and give it to someone's hands and you just hired this girl. She's been doing it somewhere nearby And then the next thing you know, she's burning somebody or giving
Mhm.
false expectations. And that's what I see a lot.
I
I
have to
see the
say that,
lack of
yeah,
care.
the worst complication that we've had from an energy device actually happened during the training session for BBL. So BBL is intense pulse light or broadband light. So BBL is like a name brand version of that. I'm not telling you something you don't know, but for our audience. And so it's like a laser, but it's not a laser. It's a band of wavelengths, not a single wavelength. But anyway, this was supervised and completely driven. The entire treatment was driven by the trainer, not by anybody in my clinic, right? And anyway, that was definitely the worst outcome of any treatment that we've had in my clinic in the 10 plus years we've been in
And
existence.
why, what do you think happened there?
Well, I think the settings were kind of high and the patient was too tan and should never have been treated at all. So, patient is a model. She shows up for the training session and my people are being trained, but they don't screen her out because they don't know. And the trainer was like, oh, no, you're fine. And then,
Did you ever do one test patch, one test fire
I
first,
don't,
and then
I
take
don't
a
really
moment?
remember because I was
I'm
there
going to
for
say
that,
probably
but
no.
yeah, I
And
mean,
this is my problem. I've been in trainings and done trainings, and the problem is someone goes and shows you how to press a button to a protocol, press a skin type, how to
yeah,
start. And
yeah,
that delegate thinks they're good to go. But what they
yes.
don't think is let's do one pulse and look for a clinical endpoint before we go doing a full treatment. And I think if all providers practice lasers that way, there would be a lot better outcomes.
And there's so much that goes to clinical judgment, which you have over time and experience and training. So, if you're brand new and a trainer's there, you're going to defer clinical judgment to the trainer and they didn't question it. That's the other thing is when there's somebody in charge who says, oh, it's fine, and people under them don't question it. I
That's
do
true.
think a
They're
lot of
learning.
times lasers are being delegated to people who absolutely have no idea about anything. They don't know about laser physics. They don't know about fluent. They don't know about all the things, right? And so they're just doing what they're told. And the problem is it's the practice of medicine and you have to exercise clinical judgment. And really the way the laws are, it's set up so that the medical director, meaning me, like I'm supposed to use my clinical judgment and only delegate to someone who I know really knows what they're doing. But the way the industry works isn't like that. It's somebody wants to do it who hires a medical director to green stamp what they're doing. And
Yeah.
unfortunately, it's really like the opposite of the way it should be done, right?
Yeah. I
So a
agree.
lot of what I'm talking about in the podcast really is like trying to teach all the consumers what's going on because I don't think they know. Like they could walk into your place and you've got way more experience with lasers than I do. And I have my MD and you don't, but you know way a ton more, right? Like I know my couple lasers that I have. But even then, like I'm pretty conservative with them, right?
I'm
But
conservative too. There's nothing wrong with that because
oh
you can
yeah,
always
but
bring them back. So that's
yeah.
not everyone is like that. You know
But
what
I'm
I'm
saying
saying? Like,
like the average consumer walks into, the place down the street from either one of us, getting somebody who really has no idea what they're doing, and they don't know the difference. It's really impossible to tell, right? I mean, you can talk to the provider and try to ask them questions, and if they sound like they super duper know what they're talking about, they probably do, right? Or you can ask them questions, and if they answer in weird ways that are a little evasive and are a little too global, oh yeah, we get great results with this laser. Chances are you could maybe figure out that they don't know what they're talking about, but it's really, really hard to tell. So
it's
yeah.
true.
So I'm curious to know like what are the kind of craziest stories you've encountered since you've been in this for so long? Like, can you think of the top
As far as
5 crazy stories? You
patients
name
or
it,
the nursing
anything.
schools or the,
Yes. Yeah. Yeah. How about let's start with
well,
the nursing school story. That'd be great.
okay. Well, let's say I definitely have some interesting stories and a couple funny ones, which I'll add. But I do, after I left New York, I ended up near Atlanta and I decided I worked for a dermatologist. And this is crazy, but at the time, you could be an RN and you can inject Botox. And he wanted me to go and get licensed to do that. So sent me to nursing school. And then in that last clinical surge rotation that I was in. I was in an operating room and they were doing a fat transfer at the surgical center. And so this doctor walks in and she's teaching another internist, and there's a surgical assist, and I was kind of rotating the patient on the table. They would put the patient under twilight. The anesthesiologist drew up the meds and left. Nurse anesthetist pushing the meds, and about 15 minutes into the procedure, the patient wakes up kind of lightly moaning, saying, "It's burning, stop." She's trying to pull the IV out of her arm. I'm told to restrain the patient. I did. And then the patient's screaming, and the doctor takes a rag and shoves it in her mouth, her obstruction of airway. And I just was stunned, and I'm like looking around the room, reading the room, and everyone's just kind of looking at the patient. And I just can't. So I pulled the rag out of the mouth and I said, "Why are you obstructing her airway?" And she said, "I have patients out in my waiting room. I don't need people to hear this." And just went off. And I was so upset. I walked out and shook it off. The surgical assist said, "Just go back in a few minutes. It'll be fine." And my skin is burning. I don't know if you've ever been in a situation where you're like having a
Oh,
attack
yeah.
and you don't know how to handle it. I knew she was a medical doctor. I'm a nursing student. So what can I do? So I just went back in, drew up the fat. They had the patient flipped over, hand her the syringe. She starts injecting it in the hip. Patient kicks her legs back, gurgles, starts urinating all over the place.
Oh my God.
I know it's not a good thing. They flip her over. Her eyeballs are just lifeless. And now I just walked in the room 5 minutes prior. So they start trying to intubate her. Nothing is working, fitting size wise. And she's calling for atropine. I'm in the crash cart's out of epinephrine and atropine. And I'm in the closet looking for it. Then she takes out the defibrillator and the battery's dead. So
Oh my
every
God.
single thing in this 15-minute time period. And I say, "I'm going to call 911." And she's like, "Don't call 911, yelling at me. I am 911. Yeah. So
Oh
I
my
walk out
God.
of the
Oh
room
my God.
and I call 911, and to find out this woman lost her license, but she apparently had taken a shot of Versed before the surgery. So this is just explaining to you the shit show that I was in, the
Oh
state of
my
mind.
God. How did
And
the patient do? Or did she
well,
die?
the 911 responded and sent their paramedics, which this day happened to do a paramedic teaching class with an additional 12 students. So I had
Oh
about
my
16
God.
additional people in the OR working on her for 1 hour. And when they took her out, she was not pronounced dead, but they had her arm strapped to one of those chest compression machines. And I could just see as she passed me in the doorway,
Oh my
her eyes
God.
were just lifeless. And I just was heartbroken. And when they left the room, the OR, you can imagine what a mess that was. Stuff everywhere, blood, just things, everything, garbage. And everyone left. I cleaned up the room myself. I went home and I got a
Oh my
call that
God.
she was DOA.
Oh
Time
my
she
gosh.
arrived to the hospital. And I just was not cut out for that. Not cut out
Well,
for
that's
that
not
at all.
normal. I mean, that's really, I mean, I've been a doctor for, I don't know how many years now, since 1994, and I've never heard such a horrendous story. I mean, okay. So the doctor who did all that, she lost her license. So she's not out there practicing or anything.
Well, not at first, but first, before she lost her license, she made sure to call my nursing school and let them know that I disobeyed in the OR and I got in trouble. I didn't even
Oh my
finish
God.
that semester. Yeah, it was the end, and I got reprimanded.
Wow.
I also owned a med spa. She called the city and reported me and two other girls that were in the room that came to work for me, and I got my business license taken away. I then decided to
Oh
move to
my
Florida
God.
to escape the news. She killed somebody 4 months later. 4 months later, another person. Yep, that basically she did liposuction and didn't close her wounds, and the patient bled to death in recovery there at the
Oh
site.
my God.
So
Wow.
all of this CBS News
Uh,
drama wanting to question me, it was horrible. So she then moved to the Virgin Islands. They found out. She ended up losing her license. I believe she went to jail, and I don't follow up anymore with her. And the poor woman that passed away had nothing, that she left behind a single, like a daughter that had no other parental figure.
wow.
Lawyer who defended this dead woman ended up adopting. So the story is really good. It took 6 years. They got money from the anesthesiologist, and the not to
Wow.
go on a rant, but when I was in nursing school, they didn't teach me anything about Botox. They didn't teach me anything about skin. They didn't teach me anything but being in a hospital setting and taking care
Sure.
of elderly people, assisted living. I can do a catheter if I need to. It's just all
Right.
these things that weren't applying to what I wanted to do. And so
Right.
when I moved back to Florida after that and just said, I think I'm just going to stay in as being a licensed esthetician. Financially, I made really good money. And every state I live in, I just go and follow their standards for getting my laser license. And they're all different, right? And I've had to
Right.
do a lot of silly stuff, but to get these licenses, but it's my passion.
Yeah. And I mean, it can't be too hard for you to study for those tests if they make you take a test because you could
No.
teach that.
Well, yes, teaching lasers is one thing, but the state of Florida, if you're not an MD or PA, or NP, you have to go to electrology school. You have to learn how to insert a needle probe into a hair follicle and do thermolysis or blending a galvanic old school
Hmm.
and release a hair for 320 hours. And then you only have to complete 30 hours of IPL/laser to get your laser license in the state of Florida, which costs the average student $8,000 to $12,000.
So wait. So hold on, back up here. You have to spend a lot of time doing electrolysis, okay? Which I've had electrolysis. It's painful, but whatever. You want that person to be skilled. That's fine. But you're telling me that electrologists only need a teeny tiny little bit of laser experience before they can wield lasers? Are there limits of what they can do with those lasers
Yes.
then?
Yes.
Okay, so
The
what
limit
can they?
is laser hair removal, which does follow suit with electrology. And then they allow
Okay.
you to do IPL, BBL, or IPL. Not legally supposed to
Huh.
do leg veins or brown spots, but
Uh-huh. Or
how everybody
resurfacing,
gets around
presumably.
that, yeah, no nothing ablative. But how you get around treating a brown spot, like you're allowed to do it with an IPL, but not a hair removal laser. So if I'm doing hair removal and go over a brown spot, it's obviously going to treat that brown spot. So the odd
Sure.
is there's hair on every square inch of the body. And
Of
that's how
course
in the
there
state
is.
of Florida, people get away with doing non-ablative lasers that are outside hair removal.
Oh my gosh. Okay.
Yeah.
So to remind you, I just told the story of the worst complication I've seen with lasers was actually with an IPL,
Yeah,
which they're
it's
handing
more
to,
dangerous.
yeah, it
IPL
is
and BBL
because of
is
the way
very risky. Yeah, it's
yeah.
very, very, very a large amount of energy and a very superficial depth of tissue where all that
Right.
water, all those structures lay. And in my opinion, IPL should not be really so easy to have a license to do in the state of Florida where everyone's exposed to sun.
Sure.
Because one thing I am really good at is helping people get out of blocks of IPL burns or
Hmm.
fixing scars, but it is, yeah, not managed right. Now, the Department of Health manages the Board of Electrology, which governs laser and electric license.
Okay. So completely separate from, so what kind of training are providers supposed to have in order to do the other kinds of laser like resurfacing and treating, red lesions and brown lesions? What kind of training are you supposed to have for that?
So more than likely, the most common training that available to them is like, let's say they have a laser device. I'm going to throw a name out there, Cyton or Candela,
Hmm.
and you want to learn how to do leg veins. Then they usually call a trainer. The manufacturer will send a clinical trainer that is certified to train on your device safely. And they usually send a per
Right.
diem trainer who maybe does this, they work, or someone that works for the company to guide you through.
But in
Now, a
order
lot
to
of
legally do that, you have to
mhm.
be a doctor or a PA.
You have to be an MD, a PA, or a nurse practitioner. If you are an RN, you still have to go to school for the electrology unless you're under medical supervision.
Sure. So an RN, I think the
An
whole
RN,
RN thing is so
it's very gray.
okay. It's very great.
It's very
I
gray.
I know that I think this was Florida. I learned this recently that RNs are not allowed to inject in Florida.
No.
Um
In New York, yes, but not in
and
Florida.
and there was one RN who petitioned the nursing board to be allowed to inject Botox only, and she won that petition. But then RNs throughout the state are using her case to justify doing it anyway, even though it's not legal for anybody else. That's what I had heard recently. Again, I'm not in Florida,
That's
so this
interesting.
is like
No,
a
well, this used to be the way in Atlanta, right? You can't ever inject a filler because it's a medical device or implant, but Botox, generally has been in more states accepted by RNs. And the same thing, right? New York City, you go to the best of the best there, and RNs, an RN of 2 years could probably inject your Botox legally under medical supervision.
Yeah. Well, in New York City, it's really interesting. There's a laser place on every corner. So I have a kid at NYU right now, and so I was there not that long ago, and I'm like, oh my God, they've really proliferated. It's like Starbucks or David's Cookies back in the '80s. There's a lot of them. All
It's
right. Well,
funny.
let me just ask you because I want to know, I kind of want to talk about the happy side of lasers. So, because we both love lasers and they do kind of amazing things. So, what is your favorite laser? If you can narrow that down. And then what are your favorite laser treatments to do? What do you think is like the biggest bang for your buck when it comes to lasers?
Well, I get asked all the time, what's your favorite laser? And it's so hard. I feel like I'm Switzerland. I like them all. But if I had to pick one, I think just the wavelength of a long pulse ND YAG, because it can do so many things and it's safe for so many skin types. One of my most favorite treatments that I think helps so many things. It's like, did you ever see that movie, My Big Fat Greek Wedding, where
Oh
the
yeah.
guy has Windex for everything?
Yeah.
So that's my laser genesis or YAG laser facial. To me, it
Uh-huh.
helps everything. And I'm going to geek out scientifically for like under a minute here. It's still considered a long pulse, but it's under 1 millisecond. So it's not touching the skin very long. And when we fire it in that way, it's attracted to water. What we're
Sure.
doing is we're using that to kind of, if you know what you're doing, heat the skin to 38 degrees Celsius. Once you do that, so many things happen. Number one, skin tightening. Number two, you can actually reduce oil production. You could treat diffuse redness. You can kill Demodex mites for those patients that have rosacea and they suffer from just inflammatory red skin with no vascular targets. And even darker skin patients, you could do toning for pigment,
Mm.
pseudofolliculitis barbae. So to me,
Hmm.
there's just so many uses for that one on so many people. So that's my
Uh-huh.
favorite.
Okay, well that's really cool. And so of all the besides that, like what do you think are the top things that laser should be used for? So we've talked about laser hair removal already. So we just know that's great. And everybody, if they want to be hairless, go for it because it works really well. Okay. So besides that one, what are your favorite use cases for laser?
Well, I'll tell you what, that we were talking the other day about melasma, which I don't think laser energy is necessarily the best fit for. It's a tool that should be used at some point. And I think my most tricky cases are going to be my rosacea patients. And that's just because it's not like hair removal where we know it's straightforward and we fire that laser at the target and we know what's happening and that hair won't grow back. Okay. As far as rosacea goes, most people go for the target of red. So they'll say BBL for reds. But let me ask you something. If you don't see an actual vessel or target, what are you lasering? The reds in the skin are either inflammation, so we have to use something to treat inflammation, or it's somebody that with a high amount of pheomelanin, which is that red pigment. So I think people just jump the gun and say reds, laser, but maybe we need to focus a little bit more on skin health and why is this red? Is it inflammation? Is it rosacea?
Mhm.
What kind of rosacea? So I think understanding the skin is probably in common conditions is probably the most important thing I think everyone should do beside before jumping into lasers.
How do you feel about laser resurfacing? And do you do it?
Yes, I
Because I
do. In
do.
the state of New York, I'm in the state of New York.
I mean, for your skin.
Oh yes. So I like, not to be device real quick. I'm going to ask you a question.
Yeah.
On the resurfacing tip, back in the
Yeah.
day, 1990s, let's say when lasers, people
Oh,
were getting CO2. This was like a
yeah.
2 week long
Yeah.
oozing,
Nightmare.
get put
Bad. Your
out.
face
Your
is
skin looks,
off.
you
Yeah.
don't even have pores anymore. Like it
Yeah.
looks
Your face
plastic.
is gone. You look like something from a horror show.
Yeah, it's a little
Yeah.
scary, but there's things that are superficial. So I'm going to use the word cool peel. Cool peel is made by the Tetra, which is an Italian made laser by Deca. Cartessa sells them. And they found a way to deliver CO2, but so fast. They call it a cool peel so that it's not on the skin long enough to generate heat, which we need heat for tightening. However, if you do such a superficial light cool peel, that patient it has a little bit of redness and scaliness, or let's say sandpaper for 3 days and they're done. So it's just like, it looks like you just put a filter on things
Mhm.
up. If you're going to break out, it gets your pigment. And I also like the ultra clear, which we were kind of briefly speaking about with the
Yeah, I've
erbium.
just been evaluating that one for potentially in my practice. It's very tough because I have felt so I have a non-ablative fractional resurfacing laser that I love and it's super safe, right? We've never had a complication from that. And I've always felt that having an ablative laser in the med spa setting is kind of dangerous and there people are really risking getting scarring, hyper and hypopigmentation, and there's a lot more downtime, there's a lot more management, there's more potential for other complications to come up. So I've always felt that that's just too risky, and you take a normal beautiful person and they just want their skin to look better. I wouldn't subject them to this thing that was that risky. So the Ultra Clear is the very first laser that's come along that's ablative that I'm looking at and looks potentially safe enough for the med spa setting. And kind of like with the cool peel, it's a very, very, very short pulse with a little pause. So I always try to explain it so people can really follow that. But like lasers just are just hot. There's nothing cool about them. There is nothing cool or cold. This one they're calling a cold fiber laser. And I'm like, well, that is a really gimmicky name. So, and I also don't like gimmicks, right? But the reason it doesn't feel hot is because the laser energy goes in really, really, really super fast, and then it pauses long enough for the tissue to cool a bit, right? So it doesn't feel super hot. So when, especially the lower end, the easier versions of this particular treatment, you can do without any anesthesia at all. But then afterwards, your skin feels like it's on fire for a few hours, right? But
Yes.
still, it's like it's very safe in that kind of milder versions of it. But they can drill that up all the way to what they call laser coring, where they're going up to 4 millimeters deep, which is deep into the dermis, even past the dermis, which is too deep. But that, as I've talked to, I've my due diligence every time I look at a laser is I have to talk to at least 3 doctors who are using it. So I just talked to a doc over the weekend, a dermatologist who's been using it for quite some time, and it sounds like a really big, like the laser coring is a really big deal. And she does not do darker skin types with the way the company kind of said that they can do. She numbs for an hour and a half. And it's like, it's actually a fair amount of downtime. Like you're bloody. It's a very bloody thing. So it's not a little nothing, right? And it would definitely be a way bigger deal than anything we're already doing now. So I'm not totally sure that it makes sense to do those. I think maybe the more superficial versions of that treatment might be really great, actually. So I'm still looking at that and trying to decide. But these are things that, I've been doing this now for over 10 years. And I just feel like I need to know all the details before I even think about making this purchase, because I don't want to hurt anybody. And I don't want anyone to have complications that they just weren't willing to risk, right? And so I need to know all the risks in order to be able to talk about them, in order to be able to make people understand, what it is they're undergoing, and that it's safe, and this is what the outcomes are. And I think that kind of due diligence just doesn't happen out there in our industry, that people just buy the devices because some rep sold it to them. And a lot of times the person who bought it has no qualifications to even vet it or do their own due diligence, because they don't actually know about like physics or physiology. And so it's really a very, very messy industry, right? Where people
It
are,
is. They look at it as a business model, right? They're
yeah,
not
it's
looking at it
all
as a
about
medical
business and
treatment.
ROI and how much money are they going to make. And then the rep sells them on this, oh, this is such a great device. Look at these miracle photos. And they buy the device. They don't know what they're getting into. They don't know what the risks are. And only after, someone suffers a bad outcome do they even realize. And then a lot of these people aren't knowledgeable enough to realize that that was their fault. Okay, that was
Yeah.
their fault for buying it, for doing that to that patient in the first place. They don't know. And then they turn around and they go, well, this rep told me it was safe. And, well, I mean, you don't
But you're
believe
doing the
it.
right thing. Like you having that, I'm going to speak to 3 physicians that have it, that are using it, that have
Hmm.
experienced it, that like have seen the good, the bad, and the ugly and the great. And I think
Yes.
that vetting them out is smart. People don't want to do the work sometimes. They want to just believe that this is a business in a box and get it. I think to what
Well,
you were
from
just
now on, I'm
saying,
going to ask you, Rachel. I'm
yeah,
going to
just
call you
call.
before buying any lasers.
Hard
Yeah.
for me not to geek out on the little coring circles and explain to people why the ultra clear is so good, which I can advocate on. But I want to say one thing. You mentioned that you were interested in this and how it can basically core and be a bloody mess. But speaking that, I've been a director of lasers for Cartessa. I've been to so many med spas. I've been all around, and they sell so many cool peels. And so a lot of people that feel the same way that you do will buy this, 40 or 60 watt powerful CO2 device that can literally do laser cutting right? You could do a bleph, but they don't ever use it. They literally just use the cool peel, that superficial version. So you buy, let's say, $140,000 device. Maybe it's more, maybe it's less. You charge there's no consumable, and you charge $650 a treatment ish, or up higher, right? I'm in Florida, so that's the average price here. That's not too bad. And you're just saying, I'm not going crazy and deep. Like, I'm just going to use it very superficially. And if you just stay in that lane and just kind of do those light things, maybe as you get used to the skin and you start pushing it a little more, down the road yourself. But that's how I would suggest to not be afraid if you love the technology, and just do it, because your patients, if they don't go to you and you're going to do a good, safe job, they're going to go to somewhere else and might not have a good judgment like you have,
Well, thank you. I mean, that's the thing though, is I do delegate a lot of these treatments, and I don't want to risk anything, right? I do think it's very interesting, because that same company that makes the Ultra Clear is coming out with a lighter version that doesn't do the coring, doesn't do the cutting.
Tabletop kind of, right?
Yeah, kind of
I saw,
tabletop.
makes
So
sense.
it's less expensive, but it does have a consumable. And it's something that in my book, I called it a fake consumable, because there is nothing consumed. They're just charging you a per click fee every time you use it. And there are a lot
So
of
is it like a
lasers that
card?
I don't actually know. I haven't seen it. I haven't seen that yet. I don't know. I don't know if it's a tip, either way, there are all these fake consumables in our industry. And it's just a way for the company to make more money off of the device, right?
Front and make money off you as you go.
Yeah. So maybe I need to look at the cool peel at the same time as looking at this other thing.
I were you, and then get,
do side by side taste test comparison and see. Yeah, that's a good idea. Do half my face with a cool peel and half the face with the. All right. Well, I don't know if I could arrange. They're two different companies, right? So you'd have to somehow do some sneaky arrangement for a demo.
Time you're in Tallahassee, we could make that happen. I actually own a cool peel, a Tetra, that I can state of Florida. So we're going to be delegating it. We just got it. And then I'm helping Ultra Clear do an open house in my area, because I do believe in the technology. And I'm in the panhandle of Florida, and they're just not a lot of, they don't have a lot of accounts here. And I know some people that run that company that I've worked with for years, and I think they're both good.
Yeah.
Both good.
Well, it's interesting to look at the devices themselves, which there are many really, really, really good devices. And then the company that sells them. A lot of times the company is, total sleazeball scumbag company. Sorry. I mean,
No, you're right. I look at laser guys as salesmen, car salesmen, right? They're
yeah.
Most
yeah.
of them,
I mean, that joke that I did put in the book is like, how do you get a laser rep to leave you alone?
Buy a laser.
Yeah. Buy a laser, right? Because they will never help you again. And I once met this doctor from California. She was an internal medicine doctor, knew nothing about aesthetics, had never even taken an aesthetics course, but had thought about getting into aesthetics in her internal medicine practice. And somehow a Cynosure rep got a hold of her and sold her and just talked her up and basically told her, oh yeah, you're going to have a med spa in a box. Sold her 7 lasers for, I think it was something like $1.5 million or something like that. So she was in massive debt and didn't know what she was doing and couldn't sell anything, didn't know anything. And then was working in her internal medicine practice just to pay the payments on these lasers. And I met her because she came to an ASLMS meeting, just trying to get advice on like how to, do aesthetics and build a med spa and like sell, and she was basically hosed, because you can't then turn around and return the lasers. They won't take them back. You can't sell them to other people because there's a giant recertification fee for every single one of them. So other people won't want to pay you anywhere close to what you paid for it. So, and the laser companies use financing companies that are basically, rip off, rent to own places where from the moment you sign the paperwork, you owe the full, if the finance term is 5 years, from the moment you sign the paper, you owe all of the interest you would have paid over 5 years. Even if you can't make the payments, even if you were to pay it off early, you still owe all those interest payments. And so they really, lock people up they really bind people and they really mess people up. So
do you think it's a cash business if you're not from aesthetics, so to say, and you want to get into this? It's really hard to break in and find somebody trustworthy, right?
Yeah. And the laser companies are really,
Yeah.
so that's why every new device, I really have to vet the company too. And then what happens is you find a good company or two, you work with them for a while, and then they
The
get
guy
bought.
leaves and goes somewhere else.
Right.
Oh,
Well,
then they get
no,
bought.
then the
Yeah.
company gets bought by one of the sleazy ones. And
Yeah.
so that just happened to me. I've worked with one company for 10 years, and they were bought last year by one of the sleazy ones. And now I don't really know what's going to happen. They've already done one really nasty thing. So I'll just tell this story. So I have a device that uses a sterile tip. It's a great device. And at 1,000 pulses, it would always give you a warning, like you've done 1,000 pulses. And most of our treatments were maybe 1,100 pulses, maybe 1,200, right? So, but it wouldn't stop you from keep using it. I mean, as long as it's still working, it's fine. It's sharp enough. There's nothing wrong with the tip, right? And you only have like a little bit to go, 10% to go. Well, so the slimy company bought that company. And now they went in to every place, did a quote unquote upgrade. And the upgrade made it so that the machine won't work past 1,000 pulses. So now you have to get out a brand new tip to finish your thing. So it doubles the consumable cost. Yeah. So Slimerama, hate them. And I'm not really stuck with them. I could always, but it's expensive to buy a new device, right? So, but that's what
It
they're all
is.
about.
And I want to just give one little quick story. Everyone has their own experiences and opinions. And I've worked with all the companies as a contractor, as a trainer over the years. And I continue to work with one in particular that I like. They're a distributor. They do sell Cool Pill, but basically this rep in New York worked for, am I allowed to say company names or not
Yeah, you can
really?
say company names. Nothing. I
All
mean,
right. So I love every company, by the way, but this is just a true story that I'm sharing. Okay. So he was a rep for Cynosure, and it was like one of those situations where they were like, quarters closing, let's go. And like these people are driven people, but you get to a point where your company is bought and you start feeling like another number, like. So after like selling and then having leaving all the patients like you or your accounts where you're like, hey, now they're doing this, and then you're getting yelled at by your accounts and yelled at by this guy decided to just start a laser company, and it's kind of smart. There's a couple other, but he started a distributorship. So he goes to countries, which by the way, you leave the United States and you go to another country, the aesthetic culture is 100% different. I mean,
yeah.
like the Middle East, it's just so different. Anyway, he ends up finding good stuff, and before he'll sell it, he puts it with doctors like you for, he just wants doctors to use it and give their feedback. And he is like, basically his story is he was so tired of working for somebody like that he has like this different business model. And like I said, I've worked with every company, and salespeople are salespeople, but having these devices that they handpick that are basically not painful, don't have consumables, they have the longevity, the manufacturing stands behind them, and turn down a lot more ways that could have made money that maybe other companies picked up. But I admire that when someone's in sales that they actually try to do the right thing. I'm not saying does that
Well,
right
the
thing happen all the time, but I love this company that I work with.
But the problem with that is that you can only import and sell that if it's FDA approved. So
We're
you're
only
saying,
selling and buying FDA cleared and approved devices. I would not
okay,
suggest any of that. Like, let's say you get something that's manufactured in Korea, right? We would never sell that unless we have an indication and a clearance from the FDA. Otherwise, to me, that's not right. I wouldn't even
yeah.
use, I remember, what was it, Eclipse microneedle pens probably 10 years ago were hitting that where they weren't FDA cleared, and people were getting them from Canada. And I'm like, why would you even open up a can of worms to get yourself in trouble and break the law?
Well,
Just follow.
for microneedling pens, and 10 years ago, there were no microneedling pens that were FDA approved. And they were being used by doctors like me legally, because you can do anything off label as a physician. It could be my medical judgment. But if you're not a physician, you can't just do things off label. And if you're not a physician, you can't practice medicine without a license. So estheticians were getting, microneedling pens from wherever and then doing medical procedures on people. And
Well, that is
that's
true. But what
not
about the
legal.
container of the Eclipse pens, which used to be so big? There was like
Oh,
cross-contaminated body fluids. And so they were trying to say this pen is not safe. We have,
right.
and then they came out with that skin pen with this barrier, and that was the first FDA cleared pen.
Yeah.
So what I'm saying is stick with something that's safe,
Right.
for
Right.
the patient at least. And just to let you know, I'm a tattoo artist. I became a
Ah.
tattoo artist just so that I can legally do microneedling.
Ah, interesting. Okay. That's really, and of
I've
course
got all the
those,
things.
and that law is different in every state as well.
Yeah.
So like in Washington, you actually need a tattoo license to do microblading. So microblading are, eyebrows where
Yep.
they kind of permanently, draw ink,
Hair.
ink,
Yeah.
ink your eyebrow hair. Yeah. And so estheticians can't do that. You have to be you have to get your tattoo license. So it's really unusual. Like it's the one thing, whatever, but those laws are different everywhere. So it's very complicated. I think that, one thing that I'm working on that I've talked about on the podcast before is I and a few other people have founded a national organization called the MedSpa Board. We are going to be certifying med spas. And so we are basically making sure everyone in the place has proper credentials and they're using real product and they're doing things basically legally. We can't go in and inspect everywhere. We don't have an army of people, but we are going to be validating whether people are actually operating legally or not. And hopefully in the next few months we'll be launching this, but we will start to be able to show that this place is certified. So you will be able to tell the difference between, your place or my place doing things legally and the, illegal place down the block. So I'm really in the weeds in it right now. So I wish I could talk more about like what the big, beautiful picture is going to be, but we are really hoping to launch in the next few months. I think that'll really help a lot.
Well, I'm so very proud of you because there's a lot of people as aesthetics continues to grow that want to know more. They want to do things the right way. I want to do things the right way. I
Yeah.
think in my situation, it takes just that experience, right? I've lived it. I'm like since Botox, right? But there's a lot of people even doing this for 25 years. It's overwhelming opening up, your own place and
Yeah.
wanting to make sure that you follow all the laws properly because they're all chopped up. You got like licenses from 5 different bureaus just to
Hmm.
be able in Florida to do what I want to do. It's
And a lot of people launch into the business without talking to a lawyer and they have no idea that their great business idea is totally illegal. And I really encourage everyone out there, like, because we do have a lot of listeners in the industry and a lot of listeners who are consumers, but like, it is so important to find not just a healthcare attorney, but a healthcare attorney who understands med spa law, because there is basically 1% overlap between the rest of healthcare law, which governs, doctors' offices and hospitals and imaging centers and surgery centers. They know all about that. They know very little, if like essentially zero, about med spa law, because all of the things that we're talking about between operating lasers and tattoo and esthetician and microneedling and all the things that are under the med spa sphere, they're just not in the rest of medicine. And those lawyers, like, there's a big difference, right? So it's so important to consult a real healthcare attorney who understands med spa law. And there's not that many of them out there.
No, there's not. And I want to say thank you for referring me to someone. There's somebody, I won't say names, but when you get involved with somebody who's a compliance officer with no legal credentials or knowledge or schooling, maybe they've done this like me for a long time, but want to charge people $50,000 to $100,000 just to give you a binder of the laws that they've collected over the years. I feel like that's not fair
Mm,
because you're limiting people that want to do the right thing and follow the law. They're just not one central place to get it. So I think
yeah.
if I'm going to spend money, I would want to be with a lawyer that is licensed and has experience in this and can legally lead me in the right path.
Yeah. Yeah. It's just there aren't very many lawyers with that kind of experience. And as we've talked about, the industry is at this point only 22 years old, right? So there aren't that many people with that much experience in this sphere of law. So it's really important. Anyway, so I think that we're coming up pretty close to time here. I was hoping you could tell our listeners how to reach you, what the best way is, and then any advice that you would give our listeners as to like get the absolute best laser treatment, assuming they're not in Tallahassee anywhere near you?
Well, I think if you're number one, it's summertime. So just be aware, not everyone may tell you this, but most lasers, they do not do well in the summer months because of your skin tone. And that's something or even a spray tan. You'd never want to go to any laser appointment with a spray tan or recent sun exposure. That's a problem waiting to happen. But moving forward, I think lasers done in the proper hands are very good for your skin. Energy helps stimulate collagen and do all the right things that we're trying to erase. So in the right hands, you're good. And just like you mentioned earlier, I would ask the provider to see before and after pictures of their own patients, not on an iPad that they downloaded from the company. That's a sign right there. Look for Instagram, look for posting. And unfortunately, the education field is very slim as far as good knowledge and education. But I'm always happy if anyone wants to learn and you're in a specific state. I know plenty of people nationally that are really good educators in the laser industry that have earned it with me. And you can find me on Instagram under Laser Ray. It's LaserRae. And I'm in Tallahassee. My practice is called the Aesthetic Blend.com. You can go there. And I just operate between Florida and I do pop-ups in New York City at the office of Yael Halash. She's a facial plastic surgeon, has also been a mentor to me, one of my best friends in the whole world. And so that's kind of where I am. I live between New York and Florida and I love what I do.
Well, thank you so much for being on the podcast today. We will have all those links in the show notes so you can refer to that. And really, Rachel, it's been a pleasure talking with you.
I appreciate your time and I look forward to more sessions and thank you for inviting me.
If you've learned something and like what we're doing, please tell your friends and give us a 5-star rating in your podcast app. If you have a question or a crazy story of your own you'd like to share, please send an email or voice recording to info@drkatedee.com. That's DRKATEDEE.com. Or reach us through the website MedSpaMayhem.com. And read the book. MedSpa Mayhem is available everywhere books are sold. Thanks for listening. This has been MedSpa Mayhem with Dr. Kate D. We are so grateful you're listening, and we hope you've learned at least one fun or possibly disturbing fact today. Don't forget to hit subscribe on your podcast app and leave us a 5-star review. And read the book. MedSpa Mayhem is available everywhere books are sold. Links and more can be found in the show notes and on medspamayhem.com.